Thank you for joining us for this episode of the Connection Point here at the Triangle East Chamber. I'm Mike Mancuso, the President and CEO of the Triangle East Chamber. And we are happy to welcome Tom Williams, our new CEO at UNC Johnston Health, and Dr. Rodney McCaskill, the Chief Medical Officer. Thank you guys for taking the time out today to be with us. Appreciate the time. I know you guys are extremely busy.
Well, we appreciate it. Glad to be here and participate on this call and look forward to the conversation.
Wonderful. So we've reached out to the membership and the local community and got some questions that they'd like to ask you before we go into your presentation, if that's okay.
Absolutely.
All right. So first and foremost, they want to know where you both are from.
Well, Dr. McCaskill, I'll let you start off.
Okay. Well, I was born in North Carolina and moved around a lot. As a kid, my dad was in the military, so I've lived lots of places. Did high school out in Wayne County in the Goldsboro area, went to college at East Carolina, and settled in the Triangle area after medical school, and started working at Johnston Health about 10 years ago. And that's sort of my story. I now live up in northern Johnston County.
Wonderful. How about you, Tom?
I grew up just at the southern tip of Franklin County and have pretty much lived there or around there my entire life. I went to Bunn High School, and then when I got out, I went to respiratory therapy school at Durham Community College, and I got my undergrad degree at NC Wesleyan in Rocky Mount, and then my graduate degree at Pfeiffer, but have lived here in the area my entire life as well.
Wonderful. Well, we're sure glad to have you here in Johnston County. Next question we got is, what caused your interest in the medical field?
Well, for me, when I was probably like most students in high school, you know you want to go to college, but you don't know what you want to go to college for. So you're seeking direction anywhere you can. And I was fortunate enough to have a high school guidance counselor who suggested I go into respiratory therapy. She said with some of the testing that you take and my interest, and she took personal interest in the students that she was responsible for, and she encouraged me to look into respiratory therapy, and I did, and it was a great match and a wonderful field, and that's what got me started.
Wonderful. How about you, Dr. McCaskill?
Well, when I went to college, I studied chemistry, and initially thought that was where I wanted to go with my life. But after working in chemistry lab for several years in college, I decided that might not be my calling. My dad is a primary care physician, and I began to be drawn to that. I like interaction with people. I didn't feel I could be in a lab the rest of my life. So that's sort of how I ended up in the medical field.
Great story. What's your favorite thing to do here in the Triangle region?
Well, for me, my wife would tell you I love to cut grass. It seems like if I'm not at work, I'm cutting grass. I have a small farm that I live on and work on. But other than that, I have a 3-acre pond. I spend a great deal of time fishing in my downtime.
Well, I have I guess a little different story. I have 6 kids, so I spend most of my time with the kids. So what I like to do generally is whatever they want to do. And sometimes that's in Johnston County, sometimes it's in surrounding counties. Obviously, I think I'm like most of you. I like to go to the beach sometimes. I like to go to the mountain sometimes. Really though, we spend most of our time in North Carolina, no matter what we're doing.
Great. All right. Well, I understand that you've got a presentation for us today. So we're going to get that up on the screen here, and I'll let you guide us through that.
Dr. McCaskill, if you would like to discuss a little bit about the Johnston County current cases, and then I'll talk a little bit about our visitor restrictions.
Sure. If you take a look at the left-hand side of the slide, you'll see Johnston County. They're highlighted. Currently, I think this is as of today, we've had 1,200 cases of COVID-19 confirmed positive. Unfortunately, we've had 28 deaths. This leads to a case rate of about 58 cases per 10,000 residents.
And then for the hospital restrictions, when this first came upon us, of course, there was a lot that we were trying to learn about COVID-19, not just locally, but certainly nationally. We did limit and restrict visitors into the hospital, much like we do with a peak of a flu season. So I think most people are aware and understand the need for do that, where you're trying to balance the visitation, but also public health. And what's best for the safety of the coworkers and patients, and also people who are entering into the hospital. So we did restrict visitors just this past Monday throughout the Triangle. In fact, we eased up on those visitor restrictions. When a visitor comes in, we do have one visitor per patient that can come in. They are monitored and screened at the door. We ask a few health-related questions. We take a temperature and we provide that visitor with a mask. Everyone in the hospital is wearing a mask. In fact, I have my mask right here and stays with me at all times. The only reason I got it off right now is because I'm in my office alone and the door is closed. But if I step outside of this office, I wear my mask the entire time. But visitors are allowed between 1 and 9 p.m. And that is, again, the balance, because it's certainly, we have to try to protect with any type of viral, just like we did with the flu, but also with COVID-19. You try to protect the patients as well as the coworkers. But we're also balance that with the need. Patients in the hospital need to see loved ones. They need to see their family members, and that is a part of the healing process. So it is a balance between what is best for the patient as well as the considerations for public health as well. We can go to the next slide.
So, I hear a lot of talk in the community that this is just like the flu. Why are we treating this any differently than influenza? Well, statistics would really dispute that fact. I mean, the statistics would say this is much worse than the flu. You take a look at a few numbers here. During the peak week of American deaths for influenza over the past 10 years, if you take the last 10 years and you look at what was the worst week we've had in numbers of people dying, it's about 1,600 people died in 1 week from influenza. And that's over the last 10 years. So far, the peak week for COVID-19 deaths is 15,455 in 1 week. So that's about 10 times more deaths in 1 week from COVID-19 than we've had for the flu in the past 10 years. So that to me says this is much worse than just a bad flu. Continuing on with a few other numbers here, the CDC estimated that for the 2018-19 influenza season that about 35 million Americans had influenza or had a case of influenza, and about 34,000 died. So if you think about this, about 10% of the American population got the flu, and out of that, 34,000 died. So far, and this slide needs to be updated because it was initially created about 2 weeks ago. If you take a look at the Johns Hopkins website, as of this morning, 2.3 million people are COVID positive, and we've had about 122,000 deaths. So if you want to take a look at what's happened with COVID-19, we've had very few Americans infected, nowhere near the 10% that the flu infected in 2018 to 19. But our death numbers are much greater. We've had 3 times the number of deaths despite having only a fraction of the American population infected so far. Some rather alarming Johnston County statistics. Prior to COVID-19, during an influenza season, we would have maybe 1 patient on the ventilator due to the flu, maybe. Most of the time we have 0. With COVID-19, we've been averaging since mid-March about 4 to 5 patients on the ventilator. Last week, we got up to 11 patients on the ventilator related to COVID-19. Our normal ICU volume would be about 4 to 5 patients at a time prior to COVID. Since COVID started, we've been nearly full. I hear a lot of talk of, I think I had COVID-19 back in January or February. If you take a look at COVID antibodies, they've been testing folks, doing a blood test to see if they have antibodies to COVID-19. And it looks like about 1 to 2% of the folks in the Triangle region have antibodies to COVID-19. that means that you probably didn't have COVID-19 back in January or February. It probably was some other viral illness. The number of people who've had this so far is pretty low. And then alarmingly, the number of deaths are very high. If you take a look at the bar graph there, you'll see that COVID-19 has moved into the third leading cause of death in America between February and May. So fairly alarming statistics, unfortunately. You can advance to the next slide if you like. So how do you get COVID-19? Essentially what happens is an infected patient or person will cough or sneeze, yell, scream, potentially just talk. But I mean, by and large, you generate droplets by more forceful expiration. So coughing, sneezing generates a lot of droplets. These droplets are basically little water drops, and inside of those drops, virus. There are viral particles. Those viral particles in the droplets will spread throughout a room if someone coughs through the air, kind of blow in the wind. And the most likely way to catch that is to actually inhale that air that someone else has coughed or sneezed out. Then you basically got that droplet and virus in your lung, and it begins to replicate there, and you're infected. The other way you can get it is the droplets can land on a surface, and then you can touch the surface and put your hand to your face and infect yourself. It could also land on some other surface, a bed, and then you could lay in the bed and potentially get infected as well. I think that the most likely case for most people is inhaling air that other people have exhaled. And again, this graph really explains the importance of masking. The most important person to wear a mask is the sick person, because that prevents all these droplets from coming out and protects everybody around. Next slide. So the symptoms of COVID-19, I think most people are aware of these, fever, chills, cough, shortness of breath, body aches, headache. Those symptoms are similar to the flu. COVID-19 is a little unusual in that you can also have loss of smell or taste. That's fairly unusual in other illnesses. Sore throat, congestion, runny nose, pretty typical. There are some cases of nausea, vomiting, and diarrhea with COVID-19. Most people are going to become symptomatic somewhere between 48 hours and 2 weeks from the day they're exposed. So if you're exposed and you go more than 14 days without symptoms, then you didn't catch it from the person, or you had an asymptomatic case, one of the two. If you have concerns about COVID-19, you can always call the UNC helpline, which is listed there on the right. It's the 188 number. They'll be happy to give you advice and can direct you to a screening clinic if your symptoms warrant COVID-19 testing. Next slide. So who's at risk? Anybody over the age of 45 is at a higher risk. The highest risk is really for folks that are over 65. The chance of being admitted to the hospital and being in the ICU, if you're greater than 65, is very, very high. ICU, I think, rate for greater than 65 is about 20%. So it's definitely affecting older folks worse than younger folks. It seems to be there are significant numbers of very minor illness or even asymptomatic illness in older children, teenagers, and maybe even folks in their 20s. Conditions that make you more likely to have a bad case of COVID-19 would be all the things you tend to expect. If you have diabetes, serious heart conditions, chronic lung disease, hypertension, dialysis, you've got a transplant, you've got liver disease, you're on immune suppressing drugs. Those are all things that are going to make you more likely to have a worse case of COVID-19. Next slide.
So one of the things that we're talking about is, of course, the phasing that Governor Cooper has put out and what it means for our employers. What we're hearing is that we may have an update, certainly this week, maybe as early as this afternoon, from the governor's office. We have been following those recommendations and the executive orders very closely here at Johnston Health. For teleworking, it continues, and we've encouraged that whenever it's possible throughout the healthcare system. I think one of the things that may come out of this is that certainly some jobs cannot be performed by teleworking. It's just an impossibility, but we are learning that there are jobs that we initially felt like had to be on site can be done by teleworking, if not all the time, at least some of the time. So we've beefed up our teleworking policy. We're starting to look at who can work from home and who perhaps can share time in an office space versus at home, particularly for some of our business office functions and that sort of thing. So, maybe if there's a positive that comes out of this, it maybe is that it has helped us recognize and understand doing different ways of performing our job functions. We certainly are limiting social gatherings, 10 people in a single indoor space. All of our meetings now are practically virtual meetings, much like what we're having today. I think we've all at least gotten somewhat to be experts at WebEx. Now, I'll be the first to admit it's something that's get used to. It's when you're trying to speak with a group. We would all probably feel like you're better off when you can read body language and you can have face-to-face contact. But certainly through these challenging times, it makes sense to hold virtual meetings to protect as many people as possible. And that's what we've been doing. I think it is important, the 3 W's, to point that out. We do all wear face masks. We require everyone in a hospital to wear a face mask. We're respecting the 6 feet apart distancing whenever we can, and washing our hands. And that's something that not only when you're at work, but when you're at home, when you go out to the grocery store, wash your hands. I think that will help us, and hopefully that'll be something that sticks with us and in the future for preventing COVID-19, but also preventing the common cold and preventing the flu and so many other things that can be avoided just by washing your hands. But if we'll go into the next slide. This is a fairly detailed slide, and we'll post this up, and I know you'll make it available to our members so that they can reference it. One of the things that maintaining a safe and healthy workplace, a couple of things that I'll point out here, and I think is probably the biggest challenge for us, and I think it will be for most of the businesses, is break rooms. It's fairly easy for us to have on our mask and practice appropriate hand washing, something we're already doing in a hospital anyway. But when our coworkers want to have some downtime, they're probably like most places when we were building hospitals years ago, a break room is not something that you make very expansive. It's meant to be where 5 or 6, 7 people can get in and they can have a break or eat a quick lunch over 30 minutes. They can talk and have a little bit of downtime, put their stuff up, wash their hands, and get right back to work. And now we're finding that as we look at that, if there is a place that is endangering each other, is when we all are coming in and you kind of let your hair down and you take that mask off, because clearly you got to take it off to eat. So one of the things that we're looking at now is we're going through the hospital, looking at all of our break rooms and places that people dine at where they have to take their mask off and are in close quarters. And how do we manage that? And how do we manage break times? And how do we manage when people take their lunch breaks or dinner breaks? And how do we assure that they are wiped down, the tables are clean, but also the appropriate distancing when masks are off? And really how we manage that in the cafeteria as well. So I think all the businesses, that'll be something that we will probably all equally be challenged by and try to do what we can to protect our coworkers and protect each other. Also, I wanted to point out our Wellness Works team, and Jamie Pierce has her contact information there on the screen. Certainly reach out to Jamie. Her and her team can help you out. And please, if you have questions about this slide, or you need more thoughts or ideas or a quick consultation on how to keep a workplace safe, Jamie is certainly trained and can help provide that as well. So next slide. So we talked about it a little bit, continuing best practices outside of work. Well, certainly a part of keeping each other safe, we're focused on our workplace, but then also what can we do as individuals as we go out? We should be encouraging our coworkers to do the same. Anytime there are frequently touched surfaces and objects, want to be sure they're routinely disinfected. That's things like doorknobs and handles, light switches, keyboards, desks, phones, toilets, anything, gas pump handles. I keep hand sanitizer in my car at all times, and when I get in my car, that's the first thing I do is use hand sanitizer. I also want to point out too about wearing a mask. I keep a mask in my car, and I wear it when I'm out in public. And I know it's particularly people that are watching this are saying, well, it's getting to be summer, that thing's hot, it's difficult for me to breathe. And yes, I know it's challenging, but it's as Dr. McCaskill explained, it's the safest thing we can do to protect each other. And I think it's going to be the safest thing we can do to ensure that we can continue to open up businesses. Certainly if we state that, all right, we're going to close everything down and we all stay at home, that was necessary at the beginning of this so it could give us the appropriate time to prepare and get the personal protective equipment that we needed so we can treat patients and care for patients and doesn't overwhelm our healthcare providers. But now that we're opening things up, we're just going to have to try to use common sense and wash our hands and practice social distancing and wear those masks, because it will allow us to keep employers to keep their businesses open. And I think it's the safe thing to do. And I think it's just something we're all going to have to get used to until we get ahead of this virus. Next slide. So job stress and mental health. I think it's really important also to take care of each other, not just in the workplace, but I think, I think about particularly the elderly that's in our communities that are probably shut in more because of this. Their places of worship, their other social interactions are limited. I know if most people, my mother will be 92 in September. When I visit with her, I do it outside on the deck. I do not go in her house because I do not want to risk bringing a virus to her. But, it's certainly limited our interactions. So I have to talk with her more on the phone. I have to text with her more, and I try to be more conscious about going by and visit her, even if I'm standing outside in the yard more often. I think if you have neighbors, try to check on them, particularly if they're elderly, and try to have more of that interaction that you can, but keep an appropriate safe distance from them. I think we just needed to know and understand that people are frustrated. They're angry over having to wear a mask. They're angry about what this has changed in our lives. And we just have to really, acknowledge that and have those open discussions as much and be sure that people feel comfortable talking about that so we can talk it out. The human condition is we're sociable creatures, and this has changed up all of that for us. So people have to recognize that, depression is a real thing. People have trouble sleeping, they have trouble concentrating. And really about the only thing about that we can do is communicate about it, acknowledge it, and try to get the help that we need and continue to discuss it. We do have a crisis solutions for our county down at the bottom for reference as well for more information on that. But I think it's important for us to talk to each other about these symptoms of stress and mental health so we can take care of each other. Next slide. And I believe that's it for our formal presentation. Mike, any questions otherwise that maybe we didn't touch on?
Yeah, well, we've got some questions from the members and some folks in the community. The first question we have for you is, how should we best address employees who are fearful about coming back to work?
Well, again, I think the main thing that we can do as employers is that ensure them that we're taking appropriate protections. And it's certainly understandable if someone says, well, I'm really worried about it. The first thing to understand is that's a real feeling and a reasonable and a rational feeling. So recognize that how they feel about it, it makes complete sense. And I'm sure they're probably in the majority, a lot of people feel that way. But we also need to understand that, okay, we're taking all the protections that we can for you. We're providing you, we're ramped up, and I can say like for Johnston Health, we've ramped up all of our cleaning areas. We've marked out spaces for social distances in our waiting areas, and we're also providing masks for everyone that comes into the facility. So everything we know about COVID-19, we are using that to try to protect each other and our visitors and our patients. And I think as long as you have those conversations and you're doing everything that you can to protect them and they feel protected, then it's worthwhile, and that can provide a little more comfort.
Good. Dr. McCaskill, this one's for you, I think, is after an employee tests positive, when can they come back to work?
The best information that we have currently would be they can return to work 14 days after their symptoms onset. There have been several studies, medical studies, where they have tried to grow virus out of patients. So essentially, to try to make things simple, they will put a swab in a patient's nose and test to see if they can grow any of the virus out. And it appears, at least in studies of a couple hundred people, that after about 11, 12 days or so, they're no longer able to grow virus from their nose. Their nasal test, if you test them for virus, may still be positive, because those tests are based on a small segment of the virus, not the virus in its entirety. So you may have a person who's tested positive, was sick, tested positive, that continues to test positive for weeks afterward because they're incomplete viral particles still coming out of their nose. But from an infectious risk to others, about 14 days from the start of symptoms to the time they can safely return to work.
Thank you. Next one here, it says if an employee has had contact with another employee who tested positive, but they do not want to be tested, should they be made to come to work? We have some employees who are stating that they do not want to be tested, but because they have had contact with an employee who tested positive, they believe that they need to isolate for 14 days and still get paid.
So we follow CDC guidelines for employee exposures or even possible exposures. Those guidelines instruct us to ask the employee to self-monitor for symptoms. We only place them in quarantine when they're symptomatic or if they are positive.
Okay. When is COVID going to be over? That's the big question. Has it peaked yet? What is the outlook, and how long do you think this will be with us?
Well, it clearly hasn't peaked yet. The numbers continue to go up, day by day. The best information that we have is it appears there will be a peak sometime in late September. So numbers will continue to grow between now and September, and then it'll gradually trail off from that point. So, my belief is it's going to be around for at least a year. It may be around forever. I don't think we really know. It may become seasonal like the flu. So at this point, we don't know how long it's going to last.
Okay. Last question I have here is, if I have an employee who is sick, is it safe for them to go to the hospital?
It's absolutely safe for them to go to the hospital. In fact, one of the things that we are encouraging, certainly if you're symptomatic with these symptoms that Dr. McCaskill discussed, that you should be tested and you should be talked to about what their options are and how you should be treated, mainly for limiting exposure to others. But further than that, one of the things that's probably one of the biggest concerns that we had, particularly when COVID first started, and is that the ED people coming into the emergency department for things like heart disease and chest pain and strokes trailed off a great deal, not just in Johnston County, but across the nation. And it's not because we think people were not having chest pain or having symptoms of stroke. It's because of fear of getting out and coming to the hospital. And then as these symptoms manifest themselves more seriously, then when they do come to the hospital, they're a lot sicker, and that certainly is problematic for long-term outcomes. So we are encouraging people. We're taking the safeguards that we have. We are reopening up. We are doing surgeries. When we initially had COVID-19, again, while we were in the process of trying to understand the fight that we were in for and trying to understand and ensure we had appropriate protective gear for everyone. We initially, everyone on the call probably recalls that we started to delay elective surgeries. We actually ended up postponing here at Johnston right at about 300 surgeries at the onset of COVID back in March. We are opening those back up. We're screening patients that are coming in, testing them for COVID, and also we're opening up our elective surgeries for what's needed. These surgeries are needed, and anybody that's postponing, care certainly runs the risk of having more issues down the road. So we are opening back up, and we're balancing that. As Dr. McCaskill said, COVID is with us. We have not peaked yet, and will be with us for some time to come. So we're all balancing the care for all needs other than COVID. And I think that's just as important. But yes, it is safe to come in. We encourage people to come in, see their physicians. I think it's interesting. We talked about earlier some of the things that may come out of COVID, and maybe it's a positive, is the increase for virtual care. We're seeing a lot more, I think, physician practices, and all of us are more and more doing consultations and follow-up and screenings with virtual care. So that's going to be important in the future, and maybe we'll actually improve access, because people that will say, I don't have time or the energy and I don't want to go to a doctor's office, with or without COVID. But maybe they'll get on an iPad or a phone and they'll have a conversation with the physician one-on-one, much like we're doing right now. And I think there'll be advantages to that. You know, the one challenge we have, a lot of places that need access does not have broadband. And I think that'll be the next thing that we really need to push for our county and surrounding counties, particularly in rural areas, is broadband access, so we can continue to improve virtual care for patients as well.
Oh, and I would add, I just literally in the last 30 days had my follow-up checkup with my doctor virtually. It was a very pleasant experience. I thought it was very thorough. We were able to do a lot more over video than I expected. And I've also had one visit to the doctor's office for some testing checkup, and never felt unsafe. Everybody was taking some wonderful precautions and making sure that I was kept safe, and at the same time I was wearing a mask, keeping them safe, and the system worked very well. And thank you for putting all those things in place to keep us safe. Any final words, gentlemen?
Well, I think I appreciate the opportunity. I think if anyone has any questions, by all means, reach out to us. We're here to help. We're partners in the community, and we're here for whatever we can do to help our fellow employers and businesses open up and keep each other safe.
Dr. McCaskill, any final words?
I mean, the one thing I would say is the request I have of you all is to wear a mask. I think that's the single best piece of advice I can give you. You know, if you're not worried about catching it yourself, then wear a mask to protect everybody else when you have caught it. The mask is really to protect, is to keep you from spreading it to other people. So it has nothing to do about being brave or strong. It has to do with, you know, protecting everybody. And that's why the hospital is one of the safest places to go, because everybody has a mask on here. So, you know, if you're not afraid to go to the grocery store, department store, you really shouldn't be afraid to go to the hospital, because everybody is wearing a mask here, and they're not doing that in other places. So please wear a mask and encourage your friends and family to do the same.
Well, thank you, gentlemen, for taking the time today. Thank you for all you're doing for our region. We should all feel a lot safer with the work that our health system is doing here for us. And again, thank you so much for all you do. Thanks for being with us. Thanks for being with us.